Why does TB relapse occur after treatment? Imagine completing a course of treatment for tuberculosis and feeling confident you're cured. But then, months or even years later, the disease comes back. Why does this happen? The main reason is that some bacteria from the original infection manage to survive the treatment and later become active again. This process is called endogenous reactivation, meaning the bacteria that were already in your body start multiplying once more. It's different from getting infected again from a new exposure, which is called reinfection. One of the biggest reasons for relapse is that the bacteria are not completely eradicated during treatment. Tuberculosis bacteria can hide in hard-to-reach areas like lung cavities or enter a dormant state where they grow very slowly. Because these bacteria are less active, they are harder to kill with antibiotics. If the treatment is too short, interrupted, or not fully effective, some bacteria can survive. These survivors can later wake up and cause the disease to flare up again. The length of treatment and how well a person sticks to it are also crucial. Standard treatment usually lasts at least 6 months, sometimes longer depending on the case. Missing doses or stopping treatment early leaves some bacteria alive. This incomplete treatment increases the chance that bacteria will survive and cause a relapse later on. Drug resistance is another important factor. If the bacteria are resistant to the drugs used, or if resistance develops during treatment, the medicines may not fully kill the bacteria. Resistant bacteria can survive and later cause the disease to come back. For example, resistance to drugs like fluoroquinolones has been linked to higher relapse rates. People with weakened immune systems, such as those living with HIV, are more vulnerable to relapse. Their immune defenses may not be strong enough to keep the bacteria in check, allowing the bacteria to reactivate. The bacteria themselves can also change genetically during or after treatment, making them better at surviving or resisting drugs, which can lead to relapse. Relapse can happen any time from a few months to several years after finishing treatment. Most often, it occurs within the first 3 years. That's why doctors recommend careful follow-up after treatment ends to catch any signs of the disease returning early. In summary, tuberculosis relapse mainly happens because some bacteria survive the initial treatment and later become active again. This can be due to incomplete treatment, drug resistance, or a weakened immune system. Ensuring the full course of therapy is completed, testing for drug resistance, and monitoring patients after treatment are key steps to reduce the risk of relapse. Always consult healthcare professionals for personalized advice and follow their guidance closely to stay healthy.